If as a continent we keep having these big talk shops about healthcare and the importance of it, but we cannot come together and ratify some basic rules that will allow us to standardize our processes so that we can have access to our own firms and our own businesses being able to produce, then we are not being honest in the conversation. 50% of global deaths of children under 5 happen here because of pneumonia, because of diarrhea, because of tuberculosis and malaria, all of them treatable. And part of the biggest problem is just access to the medicines.
It is essential that we all leave this room as activists for food procurement at the continental level.
It is part of the wider story of achieving equity and opportunity in Africa. We did a procurement of the rotavirus vaccine, and at the same time, South Africa was doing the same. The advantage that South Africa gained was that they, as being a bigger country, got half the price that Seychelles paid for that same vaccine. Now, if we are to translate this to a continental situation and we're able to procure essential vaccines on a continental level, we will dramatically reduce the cost of vaccines.
If Africa had to begin to procure and produce its own drugs, we will be able to create 6 million jobs.
The government has recently constructed an industrial park which is dedicated for pharmaceutical manufacturing and has developed different investments, incentive schemes for those who are investing in the pharmaceutical sector.
The endorsement of the establishment of an African Medicine Agency, AMA, by heads of state and governments as a regulatory body is to provide the requisite continental leadership to ensure that there are harmonized and strengthened regulatory systems that govern the regulation and manufacturing of medicines and medical products on the African continent.
We have realized that when there is no corroboration in the region, there is an issue of movement of substandard and falsified commodities throughout the region. We would want also to encourage that, if possible, Your Excellencies, especially the Ministers of Health and Finance who are here, to help look at the laws, the regulatory environment, especially the ones also involved with procurement, which can be prohibitive for this initiative.